Good afternoon, everyone. We're going to go ahead and get started today because we have a lot of information to cover. We want to make sure that we also have time to answer questions at the end. My name is Jennifer Whitener, and I am the Benefits Manager here with Larimer County. Just a couple of house cleaning items for today before we get started. Just want to let everyone know that this presentation is being recorded. If you know someone who wanted to attend today, but they can't, we will have the recorded version of this webinar posted out on our benefits page. And we have a QR code at the end of this presentation that you can scan, and it'll take you right to the site where we'll have this posted. In addition, we will be doing this same webinar once a week for the next 3 weeks. So if someone wants to attend live, they are welcome to do that as well. I will say that microphones are muted, so you will not be able to unmute yourself to ask a question. So you do need to submit your questions via the chat feature. And Lauren Emery from our team, she will be monitoring and answering those questions for us. If it's something that Lauren doesn't respond to directly in the chat, we will make sure to cover all unanswered questions at the end of the presentation. All right, well, that being said, I am here today to talk to you about our 2026 medical plan changes. So we'll go ahead and dive right in. So in terms of what's new for 2026, we will be moving from Meritain to UMR. So if you have been with the county long enough, we were actually with UMR prior to Meritain back in 2020 and had been with them for several years. This means that we will be using the United Healthcare Choice Plus network. It's a nationwide network and the same network that we had previously. When we did our evaluation, looking at Meritain's network compared to UMR's, the good news is that we will not have any disruption in terms of which providers are in network. So UC Health, Banner, Family Care Center, they are all in network with United Healthcare, just like they are with Aetna today. So you shouldn't see much disruption in terms of needing to change your healthcare providers. New ID cards will be mailed in December, so be on the lookout for those new ID cards in the mail as well. And I did also want to note that we will be staying with CVS for our prescription drug benefits. So there won't be any changes to our prescription drug benefits for next year. Those will stay the same. So the first big change, like I mentioned, is that we will be changing from Meritain to UMR. The next big change that we want to spend most of our time talking about today is that we will be changing the plans that we offer for next year. So the first plan, and the one we'll be spending the most time talking about today, is our new Surest zero deductible plan. The second plan that we will offer is our high deductible health plan, which is what we offer now. So the choice and the standard plans will not be offered next year. You will have two plans to choose from: that Surest zero deductible plan or the high deductible health plan. So that Surest zero deductible plan, it is a copay plan. There is no deductible. There is no coinsurance. So the way it works is that you will pay a copay for each service, whether it's a doctor's office visit, all the way up to things more complicated like a surgery, until you meet your out-of-pocket maximum for the year. And I've listed the in-network amounts below for reference, so you can see those here. So for individual coverage, that's $5,000 a year, and for family coverage, that's $10,000 a year. So let's learn more about the new plan. The Surest zero deductible plan is what we call a variable copay plan. that will allow you to compare in-network providers and treatment options based on quality and cost. So, for several years now, we've offered Healthcare Blue Book as a tool where you could go out and research doctors and treatments using that same methodology of looking for high quality providers that provide that service at a lower cost. So it's a very similar concept, but now being integrated into our plan design. What's nice about this plan is that you will know the cost for the service you're going to receive before you go. And we will have both an app and a website available to us where you'll be able to research ahead of time, and that will be available starting in October. So we will have that available to us before open enrollment starts. But let's go over just some more information about this plan and how it works. So with this plan, like I mentioned, you're able to compare providers based on their combination of quality and cost. And Surest calls this a care rating. So a care rating is going to be on a score of 1 to 10, where 1 is the lowest care rating a provider can have, and 10 is the highest care rating a provider can have. That care rating is made of multiple factors, and I've listed just in general what some of those are, and we'll get into some more examples here in a minute. But a care rating is going to be looking at things like what is the frequency of trying proven treatments before referring someone to surgery and the success of those treatments. Does that doctor's patient base have lower rates of surgical complications? Do they have lower rates of hospital readmissions? What is the success of infection prevention? How efficiently does that provider use resources? And of course, looking at what they charge for their services. So to give you a little bit more of an example and how this can vary depending on the service, what I've got here on the left-hand side is an example for a knee replacement. So just like today, if you were to go into Healthcare Blue Book and look for a knee replacement, you will see that that cost varies for that knee replacement depending on where you go. So the same thing applies next year. And so what they're going to look at when assigning a care rating for that place where you can get a knee replacement, they're going to look at what are the complication rates for when a knee replacement is performed at that facility. What are the readmission rates? Is physical therapy provided in the hospital setting that's more expensive, or is physical therapy provided in an outpatient setting, which is less expensive? Does that hospital use out-of-network providers, assistant surgeons for that service? Looking at things like the average patient risk score and length of stay are some of those factors that they're looking at to assign that score. Now, if I'm looking at a primary care provider or a specialist, it could be a very different set of factors that get incorporated into assigning that care score. So in this example, the primary care provider copay is factored on the overall treatment of conditions, including, how effectively do they treat patients with hyperlipidemia or type 2 diabetes, lower back pain, and things like that. So here are a couple of other care rating examples that I wanted to show for primary care. And these are, two different patients, one with an acute respiratory infection and a different patient with type 2 diabetes. So you'll see here for an acute respiratory infection, they're going to evaluate for that provider. How often are they using high cost imaging to treat that patient? Uh, what diagnostic procedures are they using? How frequently are they using those? Are they using high-cost diagnostic labs or high-cost ancillary services? How many of those patients had related emergency room or urgent care visits? How many of those patients had hospital admissions? And again, looking at those patient risk scores overall. And you can see how that particular rating varies compared to how they manage a patient with type 2 diabetes. So in this example, we're going to look at what percent of their type 2 diabetic patients are using injectable drugs, what types of devices are they using to monitor their blood sugar, the percent with diabetes-related emergency room and urgent care visits, the percent that had diabetes-related eye care surgeries, uh, the percent that had diabetes-related foot amputations, which we would hope is low, the percent of visits done through virtual care, and then again, looking at those overall patient risk scores. So again, it's very specific in terms of the type of care being provided and how that care rating is scored and evaluated. Another example, a common example I thought I would share is maternity and how that score is evaluated. So for an OBGYN specific to pregnancy and delivery, they're going to look at what percent of deliveries are done as a C-section, what percent of babies have NICU stays, short NICU stays, how many patients use an epidural, use of high-cost imaging or ultrasounds. Was there compliance in terms of prenatal visits and ancillary services? They're going to look at baby risk scores, including weight and gestational age, mother's health risk scores, and then, of course, facility charges for the delivery, as well as length of stay. And I do want to note that care ratings and copays are reevaluated on an annual basis, and they will not change during the course of the year. So whatever rating and copay is locked in at the first of the year, that is what it will be for the whole year. Another feature of this plan is that it does provide a simplified experience for the members. As I mentioned previously, you'll be able to know what you're going to pay for your office visit or for even your more complex surgical procedure before you go. So on a traditional plan like we have today, you have to get multiple bills in the mail from the physician, the surgeon, the hospital, the anesthesiologist, the radiologist potentially, and it's very difficult to understand or track where are you at in terms of your deductible for the year, your co-insurance, have I met my out-of-pocket max yet? And it's a very complex process to try to figure all that out, in addition to just trying to manage your overall health depending on the situation you have. What's a nice feature of this plan is that you pay one copay for a procedure, even when multiple providers are involved. So this plan bundles all related services into a single copay. So here I have a maternity bundle example. So again, it's one copay that you're going to pay for the entire experience start to finish. And that copay range is $900 to $2,000 in this example. And that's going to include everything from your initial history and physical exam, routine prenatal visits and exams, the recording of vitals, routine labs and prenatal ultrasounds, the delivery itself, whether it's vaginal or C-section, the routine postpartum visit, as well as a breast pump. So all of those services, again, are just included in one single copay. So what I thought would be helpful is to provide just an outline of the current plans, PPO plans we have now, the choice plan and the standard plan, and how that compares to the Surest plan. So you'll see if we start right up at the top. As I mentioned, this is a zero deductible plan. So right now, our single deductible for the choice plan is $500, and for family, it's $1,000. For the standard plan, it's $1,000 for single coverage and $2,000 for family. With the Surest plan, there is no deductible. With the choice plan today, once you meet your deductible, you have to pay coinsurance until you meet your out-of-pocket max for the year. So with the choice plan, once you hit your deductible, you pay 10% of all bills you receive until you hit your out-of-pocket max of either $3,500 for single coverage or $7,000 for family coverage. With the standard plan, right now, you pay full cost until you meet your deductible. Then you pay 20% of all bills you receive until you hit that out-of-pocket max of $6,000 for single or $12,000 for family. With the Surest plan, there is no deductible, there is no coinsurance. You only pay co-pays. So those co-pays just accumulate until you hit your out-of-pocket max for the year, which would be either $5,000 for single coverage or $10,000 for family coverage. The wellness clinic will still have a $0 copay if you're on the Surest plan. Teladoc will also continue to have a $0 copay on the Surest plan, as well as preventive care services. Those are no cost today, and they will continue to be no cost on the Surest plan next year. Now we'll get into doctor's office visits. So currently on the choice and standard plans, there's a $25 copay for your office visit. With the Surest plan, this is where the copay will vary depending on the care rating of the doctor. So that copay will have a range anywhere from $20 to $105 for that office visit. For mental health office visits, currently we have a $25 copay per visit, and it is an open network on our plan, meaning the provider does not need to be in network in order to pay that $25 copay. Next year, there will be a flat copay still for mental health office visits of $15, but it will be in network only. So the Surest plan is a bit stricter in terms of what we are able to customize and allow. And in this instance, we are able to do a lower copay for that office visit, but that provider does need to be a part of the United Healthcare network. If they are not, there was a higher out-of-network copay that would be charged. In terms of specialist office visits, currently it is a $50 copay for either the choice or standard plan. And under the Surest plan, again, it's going to be that range of $20 to $105 per visit for a specialist visit. For urgent care and emergency room, it is again one flat copay. The copay will not vary based on where you go. So currently it's a $50 copay for urgent care, and that's the same on the standard plan. So both choice and standard, it's $50. On the Surest plan, it's a $60 copay for urgent care. And then for emergency room, the current ER copay is $200. The Surest plan does have a fixed copay for ER at $650. And again, urgent care and emergency room, that copay amount will be the same whether or not it's in network or out of network. That is not a procedure that has a care rating attached to it. In and outpatient hospital services, currently It's deductible and coinsurance for those hospital services, whether you're on the choice or standard plan. So next year, will be, another big change where it'll just be a fixed copay amount for that hospital service. And it's going to vary, of course, depending on the service you receive and where you are receiving that service. So this is going to be where you would definitely want to research up front on the Surest site or on the Surest app to know what that cost is before you go. Massage and acupuncture. Currently, there is a $25 copay for that benefit with a $1,000 limit, and it is currently open network. So right now, you can go to an in-network or out-of-network massage or acupuncture therapist and still just pay that $25 copay. Next year, it'll still be a $25 copay, but the provider must be in network with United Healthcare, but there is no dollar limit. So while we're glad to see there is no dollar limit, we are limited in terms of this only being able to be in network. So I do want to speak to that just very briefly to let this group know that we have reached out already to our top utilized massage and acupuncture therapists on our plan to let them know that we will be making this change next year and that they should strongly consider joining the United Healthcare Network to ensure they have continuity of coverage for next year. This includes Height of Health Massage, which is by far our most popular massage therapy group that is used by our plan. And so they have already confirmed that they will apply to join the network for next year, which we are happy to hear and hope back to be able to report that has been completed, hopefully before January 1st. It does take 2 to 3 months to get a provider into the network, so that's why we proactively reached out to them already. But if you go to someone that you really like and you would like us to reach out to them to see if they would like to join the network, we are happy to do that. We would just need to get their contact information from you, and you can send that directly to the benefits team. The other trade-off with this Surest plan is that, as I mentioned, it's not as customizable as the plans we have now. And so the following programs will be ending at the end of this year because we aren't able to continue them under the Surest platform. The first is Healthcare Blue Book, and logically it makes sense that this program would end since it would be duplicative of what we'll be seeing through the Surest platform. So the Healthcare Blue Book rewards and programs will end as of December 31st. In addition, they are not able to administer the $500 lifestyle education benefit, so that program will also sunset at the end of this year. They also aren't able to administer direct contracts or $0 benefits that we had customized and put into our plans. So that means our $0 Banner MD Anderson benefit will end, as well as the $0 copay for Family Care Center and the 8 free physical therapy visits at Colorado in Motion. So Family Care Center and Colorado in Motion and Banner MD Anderson, they are all still in network next year, but they just won't have a $0 copay for their services. There will be a copay attached for those services. In addition, the last 3 bullets, those are considered experimental and investigational by United Healthcare, and so they just do not allow us to cover those under this plan. So Regenix, Grail testing, and sensory deprivation therapy coverage will end as of December 31st. I did also want to make sure that we touch on the high deductible health plan. Just very briefly, for those of you who are enrolled in that high deductible health plan, it will continue next year. Um, the deductibles will increase slightly to $3,400 for single and $6,800 for family. And there will be no change to the health savings account employer contributions that you can receive when enrolled in that plan. In terms of premium changes, because we are going from 3 plans to 2, you'll see for the choice plan, which was our richest plan, that the rates will be decreasing significantly. And we've noted those amounts here. I'm not going to read through them each line, but it's here for reference. For those on the standard plan, the rate change next year will result in a $4 to $16 increase per month. And for the high deductible plan, it will be a $0 to $14 increase more per month. I do also want to note that we will again have a mandatory open enrollment this year, and our open enrollment dates are set as October 27th through November 7th. That's the other reason why we wanted to make sure that we gave you plenty of time to plan ahead and learn more about this new plan and compare that to the high deductible plan and see what makes the most sense for you and your family for next year. We are already scheduling several department staff meetings. So check back with your manager supervisors or your department heads or elected officials to see if those meetings are scheduled. We will also have campus office hours where we will just have walk-in time available at our various campus locations throughout the county. As a benefits team, we're always happy to just do individual appointments one-on-one by request. And, again, if your provider is a massage therapist or acupuncturist who's not in network today with anyone and you would like them to join the network for January 1st, you're welcome to do that on your side, or you can share that information again with the benefits team, and we would be happy to make that outreach on your behalf. All questions can be mailed to our HR benefits team at hr_benefits@larimer.org. And I also encourage you to scan the QR code that's on this screen because we do have a dedicated site built about our Surest plan where we'll be putting regular updates and resources out there for you to have access to. And as I mentioned, the recordings of our webinars will be out there as well. I'm actually going to take you to that site now, just so you can see what that looks like. So you'll see here, and this is just our general benefits page. It's not on the bulletin board. So you don't need B-board access to view this. So you can share it with family members if they'd like to go out and look at this as well. Where we'll have all of our webinars listed here. We'll put the recordings here, an explanation of just how it works, and some real life examples you can refer back to, as well as just general medical insurance terms, because we know insurance terms can be very complicated. And so we wanted to provide you just some simple definitions as well as you go through this. We have our direct link here where you can share this with a provider to ask them to become a part of the United Healthcare Network. So you can just share this link with them directly, or again, if you want us to do that on your behalf, we're happy to do so as well. And then you'll see we've got a FAQ section built out here where we've put a lot of our most commonly asked questions that we've received so far that you can refer back to at any time. Now, what I wanted to say for the end was just a demonstration of what the Surest website looks like. So you can see here at the top what the zip code is, so you can change that. So I'll just do the Fort Collins zip code 80521. And I want to again highlight, this is a demo site. So none of the numbers in here are real or for our plan. This is just to give you a demonstration of the Surest platform and how it works. So once I've logged in and I have my zip code set for where I want it, I'm just going to look up a medical office visit. I'll just say I feel sick and I need to go to the doctor. So it's going to give you a description to say, well, just to confirm, this is what you're looking for. And then we can go ahead and click on Find the Provider. So you'll see up at the top, it's going to list any zero cost options for you on a tile. So it's going to say, hey, just a reminder, you can do this through Teladoc for no cost, and we'll have a tile up here for the wellness clinic as well, since that's also no cost. But say, no, I'd rather just go to my primary care doc. I've been going to them for years and I just like them. So if we start up here with Dr. Schmidt, you'll see that Dr. Schmidt has a care rating of 10. And as a reminder, that 10 care rating is the highest care rating that you can have. And so you'll see that Dr. Schmidt has the lowest copay based on that care rating. But say I go to Dr. Roberson, well, Dr. Roberson has a care rating of 6 with a $45 copay because that care rating is lower. So you'll be able to research and know in advance of your appointment exactly what your copay will be. And again, these are demo site figures only. These are not the real care ratings. These are not the real copay amounts. These are just example services that we're showing you. So if I go in to look for a delivery, I'm going to have a baby. We can find what that copay amount's going to be depending on where I plan to have that baby. So in this example, it's going to show the lowest copay, highest care rated facilities first. So you'll see if I went to UC Health Greeley for that service or Lawns Peak Hospital, that it's going to have the lowest copay of $900. If I have that baby at Poudre Valley, you'll see that that care rating drops slightly, and as a result, that copay amount will be higher. And if you don't remember what all is included, if you click on that provider right here, you'll see another description of what's included. So as I mentioned, the Surest website that we just viewed was a demo website where we were looking at example care ratings and example copay figures. The Surest website that will have our actual care ratings loaded and copay figures will be available in October before open enrollment. So once that site is built and ready to use, we will be notifying staff countywide that that site is live and available for use. And then if you want to do a one-on-one with our team to go through that and help plan your costs for next year, we will be able to go ahead and do that with you. Or if that's something you prefer to do on your own, you're welcome to do so. They will also have a concierge customer service line available where if it just works better for your schedule to talk to someone at Surest customer service to help you calculate that, that will be a third option that you'll have. So with that, I want to thank you for joining us here today. I'm going to turn it over to um, Lauren and Jennifer Glover to go through any questions that we weren't able to answer in the chat or that weren't covered in the presentation today. So Lauren or Jen, do you want to start going through those?
Okay, I hope you're ready for this. Lauren and I chatted behind the scenes, and she's going to keep responding to questions in the Q&A section. So I'll start in the chat, and then we'll move over once we get these questions answered.
Great.
One question was asked about why we left UMR previously.
Sure, that's a great question. So our medical third-party administrator contract is on a 5-year cycle. So every 5 years, we evaluate our TPA and we look at various things such as what contract do they have in place with UC Health and Banner. More importantly, UC Health, because the majority of the claims we pay are with UC Health. So when we evaluated those contracts back in 2020, at that time, Aetna actually demonstrated as having a better contract in place with UC Health than United Healthcare did at that time. And they negotiate and renew the contracts with our local healthcare providers, usually on a 2 to 3 year cycle. It really varies depending on the agreements they have in place. So when we'd completed our evaluation at that time, Aetna had the better contracts. And as a self-funded health plan, that's incredibly important because whatever those contract amounts are, that's what we pay as a health plan. We fund our own claims through the dollars that we collect from departments and employees. So that ultimately is why we had made that change from UMR to Aetna 5 years ago. Great question.
Okay, awesome. So the next question is, what happens if something is ordered during an appointment? So let's say I go in for an appointment and my doctor orders a test of some kind. How does that work? Would I pay a new copay for that procedure, or would it be included in the initial copay?
Typically not if it's something where they do that test in office or they immediately refer you to go and have like that lab test done. It would just be included in that primary care office visit copay that you've already paid. Now, if it's something where you have a test and it's scheduled at a separate facility on a separate day, then potentially there could be a separate copay for that. But it will vary depending on the nature of the test and why it's being ordered.
And I believe you touched on this already, but just to verify, um, Surest only reviews their copays once a year. So if I go and get a copay estimate in January, it won't change if I can't go until March.
Correct.
Okay. So that was one question. Um, Another question is, are the copays made up front, regardless of the cost of regardless of the length or extent of the procedures, or length of stay or
Um,
extent?
yep, correct. So again, it's going to base that copay on the care rating of the provider, not necessarily if you end up having a complication as a result of that particular procedure and have to stay in the hospital longer. So that the way this works, the financial penalty then falls on the provider to eat that cost essentially because of how they managed that patient. So the copay that you owe is the copay that you owe.
Okay. Is there a copay for an out-of-network appointment for mental health?
Yes, there is a higher copay for out-of-network mental health, and it's $160 a visit.
Okay. And then some questions about the massage therapist at the clinic. Will there still be a $0 charge for those massage therapists?
No, there will not. Right now, it should still be a $25 copay for massages being performed at the clinic. So I might want to follow up with that person individually to better understand that specific situation. But typically, a massage should be a $25 copay, whether or not that's performed at the clinic.
Do you know how many massage therapists are actually in network at this time?
None of the top utilized massage therapists for our plan are in network at this time. But in terms of the number in network, I do not have that.
Okay. Will there be copays for preventative procedures and office visits that used to be no cost?
Uh, there is no copay for preventive care visits. So if I'm just going for my well woman exam, for example, there is no copay for that, just like today. If you're going to the doctor for an office visit that's not preventive, such as I'm going because I'm sick, then there would be a copay for that.
So in the past, we've always been very transparent about what the county is paying for premiums for employees. Um, I assume we're intending to share those costs for next year as well. Another one of the other questions is, what is the county's cost for each individual on the new plan?
Yes, that is correct. So in our open enrollment booklet, we always include the breakdown between the county costs and the employee costs. So that will continue to be something that we include. That's just not something we put into the presentation for today. But yeah, we always publish that information and are fully transparent about that. So no changes there. And then in terms of the per employee cost that each department would pay per employee next year, I would have to have that as a follow-up because I don't have that off the top of my head.
There's a question here that says, what about chiropractic care? Um, and that's really all I have. I don't have any other backstory or any other information with that question.
Yep. So chiropractic care, that will still be covered next year. So currently on our plan, a chiropractic visit is only covered if it's in network. It will be the same next year. So your chiropractor needs to be a network with United Healthcare in order for that to be covered. In terms of the copay, let me see if I can pull that up here quickly. The copay for chiropractic is $25, just like today.
Okay. How does Surest handle pre-existing conditions or injuries?
Well, pre-existing conditions are no longer applicable. Under the Affordable Care Act, we're a non-grandfathered health plan. So pre-existing conditions has no bearing in terms of our plans.
So there are quite a few questions about the wellness rate, and folks are still wanting to make sure that will there still be a wellness rate?
Yes. So we will continue to offer that wellness rate discount for next year. So as a single person, you can earn $480 for yourself to reduce your premiums over the course of the year for that. And then if your spouse is covered on the medical plan, you can earn an additional $480 off of your premiums if they complete the requirements as well. And I know it's September 4th, but I will just put a plug in here that the deadline to get all of your requirements done to earn that discount for next year is September 30th. So we are getting closer to that deadline. And if you need assistance in finding out where you're at in terms of earning that for next year, please reach out to the benefits team and we're happy to help you with that.
Okay. Um,
And Jen,
yeah.
sorry.
No, no, you're good.
So I wanted to follow up on the county cost question that an employee posed. So I was able to look that up here very quickly. So if we look at the annual cost that the county pays per employee in terms of our overall contribution, it's $15,480 per employee per year. And then when we exceed our budget amount beyond that, then the county pays for anything, any claims that we incur that are over that total collective amount for the course of the year. Um, the past 2 years and why we're making these changes, we've had to pull out of our reserve fund because our claims are exceeding the revenues that we've been collecting from departments and staff. And so it's a $35 million health plan. When I started here 8 years ago, it was a $25 million health plan, just to give you some perspective. So our costs continue to rise, and as a result, we had to move forward with these pretty significant changes for next year.
Okay, thanks, Jennifer. Um, there is a concern about how Surest was chosen, and if wondering if you wouldn't mind sharing the process that was used to choose Surest.
Absolutely. So, as I mentioned, we were every year or every 5 years, our medical TPA is up for evaluation. And so it's a very complex multi-month process that we do through the purchasing department in order to evaluate and select our vendor. So, our first and foremost priority was looking at, again, who has the best contracts in place with UC Health in Northern Colorado, because the majority of our claims and where our people go is UC Health. UC Health is the most expensive provider in our area. And so we needed to partner with the vendor who had the best contracted rates with them, which in this instance was the United Healthcare Network. And so for our group, they quoted us UMR. And so UMR was selected on that basis. In terms of the Surest plan, we chose that plan because we needed to, again, find a way to achieve additional savings to avoid having to pass on double-digit premium increases to our staff. Also, our departments were only budgeted to have a 3% increase to what they contribute towards health premiums. And we had to make sure that the combination of both the contracts we'd be paying through our new vendor, as well as the plan designs that we offered, were going to allow us to meet that required 3% increase that the budget office had mandated. So we couldn't keep our existing plans and meet those budgetary targets. Plain and simple. Our plans were too rich, and we had to make a drastic change. And so we hope by making this change that we will turn the tide here and make this plan more sustainable for the county as a whole going forward. This was not an easy choice. We've had those two plans in place with the county since 2008, and I recognize that this is a big change. But it was the decision we had to make in order to make this plan financially sustainable for the next several years to come. So we chose this plan because the plans we were offering were only causing us to continue to increase our spend. And we had to look at an option where we can slow that trend down. And we believe that this plan will do that. So it was through months of analysis, both through our benefits consultant, which is Lockton Companies out of Denver, internal discussions with various parties, as well as the evaluations that were done of each vendor and the services they offered, where we ultimately landed on providing this plan. If we had stayed with Meritain, we would have offered a similar type of plan. In either scenario, the choice and standard plans we knew had to be eliminated. So I want to make sure that we provide that point of reference for staff as well. There was much evaluation and thought and consideration that went into this decision-making process. And we are very cognizant and aware of the impact that this has on staff.
Okay. There's another question about discounts for using a doula. Is that still a possibility with Surest?
No, unfortunately not. So coverage for doula services will end at the end of this year.
Okay, so does the copay cover all care prior to a procedure as well? And who would we make that payment to, the doctor or Surest?
It'll be still to your doctor's office in terms of where you'll pay that copay. So you'll still get the bill from the doctor and pay them directly.
Okay, do we know if there's going to be any changes on our prescription plan?
Nope. So I mentioned at the beginning of the presentation, there are no changes to the prescription plan for next year, and we will continue to offer that through CVS.
Next question. Can an employee or spouse have other health insurance with the Surest zero deductible plan?
They can, yep. So they can be covered on their own employer's plan, um, and they don't have to be on our plan. So, yep, they can definitely have their own coverage.
Okay. Will you still have to get a pre-authorization for any surgical procedure?
Yes. So, just like today, you would still need to get a prior authorization before being approved for a surgical procedure.
Okay. Do you anticipate the wellness rate continuing next year for 2027?
I can't say whether or not it will continue for 2027 at this point. All I can say is that it will be in place for 2026.
So if you go in for a preventative visit, such as a mammogram, and you want to go yearly, but the recommendation is every 3 years, will you have a copay?
So no, that actually is a positive change with the Surest plan. So with the Surest plan, all mammograms and colonoscopies will be covered at 100%, whether you have one a year, whether you have one every 3 years. Some individuals are on a 6 month schedule. So if you have two a year, that second one will next year also be covered at 100% on the Surest plan.
Okay. One question is about the new benefits booklet. When will it be published for this new plan? And I imagine, same as previous years, happen for open enrollment, which is next month. And
Correct. So we'll have that published in early October.
awesome. Will lab work and blood tests still be covered at 100%?
Yes. So again, as long as that's, something that's routinely being performed as part of your office visit, it'll fall under that office visit copay. So you won't pay anything additional for that.
Okay. Someone has asked if there are any changes to dental or the vision insurance plan.
In terms of the plans, no. I will say for the dental plan, if you have employee plus one coverage, the premiums are increasing slightly by $2 a month. And if you have employee plus two or more coverage on dental, the rates are increasing by $4 a month. Single coverage will continue to be no cost, but that is the only change for dental next year.
Okay. Um, so someone has a question about having to get authorizations for prescriptions redone at the beginning of the year. Do you know anything about that?
No, you wouldn't need to do that because again, we're staying with CVS. So your prior authorization will remain in place until it expires, whenever that may be. So it won't be just automatically as of January 1st, unless that happens to be when your prior authorization has expired at the 12-month mark and needs to be renewed. So that's really going to vary person to person. So if that person specifically wants to know when theirs expires, reach out to the benefits team and we can coordinate that with CVS to find out when yours potentially would expire and need to be renewed.
Okay, and someone is wondering if the slides with the difference in costs will be shared with employees.
Yep, absolutely. So we'll have this full recorded presentation out on our Surest page, and which also includes that difference in cost information. And then in our open enrollments booklet, like we publish every year, it'll just have our full set of rates for you to review.
All right, Lauren, I'm ready to move over to the Q&A section. Do you want to ask those questions or are you still
I'm
responding to
s-
questions?
I'm still answering a few of them, but I'm happy to just start. I'm just happy to just start on some of them that I still haven't answered. So one of them, and I know you kind of touched upon this a little bit, but was there any opportunity for county employees to provide input before the decision was made to make these changes?
So we speak with various stakeholders within the county before we made this final decision, all the way up to the county commissioners and county manager, the budget office, as well as our insurance advisory committee that has county employees as a part of that. So yes, various parties were able to provide their input and feedback before we made that final decision. Um, just like we did previously, when we did this evaluation in 2020.
Perfect, thank you. And there's a good amount of questions regarding the ER visit and the jump in that copay. So could you kind of touch upon the changes in that ER copay?
Absolutely. So the Surest plan, as I mentioned, is not as customizable, excuse me, as our current plan. And so that is just the copay choice that we have under that plan. And so I recognize that it's higher than current. I think the intent is that they truly want to make sure that someone is going to the emergency room for emergencies only, when there is the lower cost option of urgent care available.
I'm just looking through a couple of the other ones. Okay. Looks like there's a couple duplicates. So let me just keep seeing what we have here. One question is about the wellness clinic and the wellness clinic staff. And they're basically just asking if with the changes, are there going to be any staff changes at the wellness clinic?
Yes, so we did also a full evaluation of staffing at the wellness clinic, because again, we're trying to make sure that we're meeting the greatest need in terms of what's being provided, services are being provided there. So we are looking to add a third PA and another medical assistant to the clinic staff, because right now it's getting a couple weeks out before someone can schedule and get in for an appointment. So we will be looking to add that for next year. And then to be able to absorb that higher cost, we will be eliminating the counseling services being provided through the clinic. And we'll be working with Family Cares Center on a transition plan for those patients.
Next up, we have a question about Virta Health and whether or not that will be continuing.
Yes, so the Virta Health program will continue for next year. That is the pre-diabetes and diabetes management program. That's free for people on either plan. So that will continue to be offered next year.
When searching during open enrollment, will those be the numbers? So once the Surest platform is available, when searching during open enrollment, will those be the numbers for the 2026 benefit year, or will those be the numbers for 2025? And can we expect them to change in January?
Yes, those will be the numbers for 2026 that will be loaded and available.
Does this insurance work with Medicaid as secondary insurance? All my providers are specialists at UC Health, and I want to make sure you said we could still go to UC Health for my specialists in network.
Yep, UC Health will definitely be a network.
Okay, and then this is just a general comment question. I understand that part of this rating that providers get is based on patient results, but is this care rating also based on whether United thinks that the provider completes unnecessary tests and treatments? Is there any concern that higher rating and lower copays will skew towards providers that are not willing to complete testing or treatments that are promising or potentially helpful, but not considered absolutely necessary?
No, we don't. This is a weighted scale, so they're looking at their entire block of business, over the past 3 years. So we're confident in the care rating that they are providing, and the methodology that's being used.
Will a one-time eye doctor visit still be covered, or do I need to get vision insurance?
Yes, the one-time eye doctor appointment will continue to be offered next year.
Any idea what the copay will be for an emergency where you may be transported by the ambulance to the hospital?
Yes, so if it's ambulance, it's a $375 copay for the ambulance.
With our current insurance, it still covers weight loss. Well, it's talking about the GLP-1 weight loss program at the wellness clinic. Will this still continue with Surest?
Yes, because the GLP-1 program is through our pharmacy plan through CVS and the wellness clinic. So yes, it is going to continue next year. No changes.
And last one, what about Medicaid? Can it be used as a secondary insurance? I don't think you answered that.
Oh, yes, Medicaid can be used as secondary. Our plan will always pay as primary.
And to follow up on the ambulance question, so it would be a $975 copay for ambulance and ER visit.
Correct.
Okay, I believe that's all the questions that I see that were ones that weren't duplicates from Jen's questions in the chat.
I think I saw one pop in at the end, Lauren. It asked if VSP benefits were changing at all, and so I'll just cover that and say no. So VSP, the vision benefit plan, will stay the same for next year.
And another, will the
Jen?
EAP program still be available?
Yes. So the EAP program through CompSci will continue to be offered at no cost, and will still include the 6 free counseling sessions per issue, per person each year as well.
Will the ER copay be waived if admitted to the hospital?
Yes, then it would fall under an inpatient stay copay instead. So you wouldn't pay the ER copay and the inpatient hospital copay. If you're admitted, it would just be that inpatient hospital copay.
I'm not seeing any other questions in the chat or the Q&A right now. Oh,
Jen, do you have anything else on your end that's come through?
Not there. One more just came in at the last minute asking about couples therapy. But I'll let you respond to that one.
So currently our plan does not cover marriage counseling. And that will continue to be the same for next year. So marriage counseling is not a covered benefit under our plan.
Yeah, otherwise I think we caught everything.
Okay. Lauren, anything else on your end?
nope, nothing on my end.
All right, well, we want to thank everyone who was able to participate and join today. You had some fantastic questions. And again, we want to recognize this is a big change, and we hope if you want to attend another webinar that you certainly do, or spend some time to watch this again, or have a family member watch and listen as well. Like I mentioned, we'll be available across the county, being at different staff departments, department meetings, as well as doing just open campus hours. So we'll be available and here for you to answer any questions you have. We understand and recognize there's going to be some frustration with this change, but again, we wanted to do this so that we have a sustainable, affordable plan to continue to offer our staff going forward. We appreciate you so much, and we have such a smart employee population who really gets it and understands insurance and how it works. So I just want to thank our staff and recognize you guys for that, because you get it. And you ask really good questions and really want to intimately know our plan and how it works. And so thank you guys for that. We will figure this out together as we go forward, and we are here to help any way we can. So thank you again, you guys, and thanks again for joining the presentation today. We'll go ahead and end it now.